I wish other doctors had a better understanding and comfort level with this diagnosis so that it's at least in their consideration. And I wish the doctors would understand how challenging it can be to identify where the leak is at. And it would be nice if physicians understood how to best treat this condition.
I think one of the biggest things that I faced in my practice is that there's still a lot of misunderstanding about the varied clinical presentation of spontaneous spinal CSF leak, in that it can have such a varied clinical presentation. It's not just typically an orthostatic headache, and that varied range of clinical presentation should prompt clinicians to consider the diagnosis.
Spontaneous intracranial hypotension is a varied disorder, and what I wish other people knew, both patients and physicians, was that there's no one symptom or one sign that's going to make the diagnosis. We have to be open-minded to this disorder.
Always keep an open mind and consider that knowledge in this area is progressing rapidly.
So lots of the neurology community see headache patients. They don't recognize the problem. Neurosurgery, our neurosurgery colleagues see patients with KRA1 malformations, subdurals that are spontaneous, and they don't recognize the entity. So I want to really bring more awareness to the neurology and neurosurgery community in regards to this entity, since they see a lot of the patients. We're educating headache specialists now and other people who participate in, the treatment, but we need to educate other physicians who are seeing these patients and don't know that they're seeing these patients.
The clinical advance that I think is the most important that I would like to see in the near future is a comprehensive strategy for dealing with patients who have orthostatic headache, who don't have imaging abnormalities on brain or spine imaging. This is a very common group of patients who we see, and I think we need to have better strategies for diagnosing them and making them feel like they have effective treatment pathways going forward.
The research advances that I would like to see in the next few years is to non-invasively image CSF both in the brain and in the spinal column, because we really need to come up with a non-invasive way to see where the fluid is leaking from without having to do invasive studies or studies involving radiation.